Hello, everyone, and welcome back. My name is Dr. Clara, and today we will be talking about simple extractions. Just a reminder that all the information that is bolded and highlighted in blue is something that I've seen come up on exams, and you should really try to remember those. Now, let's get into it. We can divide the extraction process into four parts. First, severing the soft tissue attachment. Secondly, luxating the tooth. Third, delivering the tooth. And lastly, post-extraction care that we have to provide and give to the patient. So first things first, when a tooth has been decided to be taken out, we have to anesthetize the patient. This might be obvious, but it is very important. So after that, our goal is to loosen the gingival and PDL fibers. And this can be done using a periosteal elevator or even a surgical blade. But be careful not to go too deep with the blade. So